Hello, my name is Tim Pawlik, and I wanted to discuss with you a little bit about our paper that was recently published in JACS on surgical desirability of outcome ranking and the implications on racial and economic privilege in days at home following major surgical procedures. So racial and economic privilege can impact postoperative outcomes. And in this study, we sought to assess the association of socioeconomic privilege with surgical outcomes using a composite measure called the Desirability of Outcome Ranking, otherwise known as DOR, and its association on days at home within 90 days. To do this, we use Medicare claims data to identify patients who underwent a range of surgical procedures between 2016 and 2021. Socioeconomic privilege was measuring using ICE, the Index of Concentration of Extremes, and regression analyses to evaluate the association of DOR with surgical outcomes, days at home, and socioeconomic privilege. In the analytic cohort, there was roughly 450,000 patients, 62% of whom achieved the most desirable outcome, or a DOR of 1. Living in areas of high privilege was associated with a lower odds of achieving less desirable outcomes and an increased number of days at home following a discharge. A higher DOR was also associated with a reduction of 10 and 1.2 days spent at home at the 25th and 50th percentile, respectively. And the model based on DOR demonstrated improved goodness of fit despite increased complexity compared with a model using textbook outcome alone. So in conclusion, a higher DOR was associated with a lower days at home within 90 days of discharge from surgery, whereas privileged patients had the highest possibility of achieving the most desirable outcomes and had increased days at home following surgery. A composite outcome ranking such as DOR may provide more meaningful insight and improve detection of complex relationships between social determinants of health and surgical outcomes.